Hey everyone, Dr. Ritza here, downtown Toronto chiropractor, acupuncture provider, manual and rehab therapist, aiming to be the best part of your day. So one of the biggest problems that I see amongst people that work in office buildings and spend the majority of the day sitting is neck and low back pain, but I find that one of the leading causes of that is actually thoracic spine immobility. So if you look at the joints of the body, you find that joints alternate between providing lots of mobility or the ability to move and lots of stability, which is a lack of movement and more control out of the joint. So if you look at the ankle, it's very mobile. The knee only moves in two directions as a hinge joint, is very stable. The ball and socket hip joint is very mobile. The low back, as we've talked about in other videos, is supposed to be very stable. And then as you move up into the thoracic spine and the cervical spine, they have a bit more mobility to them. So what I find is that people lose the mobility through the thoracic spine. They lose that range of motion and flexibility, which really wreaks havoc on their low back and their their low back and their neck. With respect to the neck, I find that the thoracic spine immobility is a huge risk factor for neck pain. And it makes sense because if you have a mid-back that curves like so, it's going to be really hard to straighten out that neck and actually put it in a good position. So what I find is working on people's thoracic spine mobility by doing some adjustments and doing some acupuncture and some active release technique, and then helping to cement those increased ranges of motion and those changes in the tissue by doing some good rehab exercises to maintain that thoracic spine mobility at home, pay huge dividends for the treatment of neck pain and for the treatment of back and shoulder pain as well. When the mid-back is able to stand up nice and tall and able to extend as it should, the neck is in a much safer and secure position, able to sit right on top of that spine where there's very little torque acting on it when it sits forward. So in terms of thoracic spine mobility, super important. And today we're going to do a couple of exercises that I love for thoracic spine mobility and start off with my favorite. So my absolutely favorite thoracic spine mobility exercise that almost all of my patient gets is the reach back. So what the reach back is an exercise we're going to do on our knees and on one of our elbows, and it's meant to increase the range of motion of the thoracic spine as well as strengthen the paraspinal muscles in that part of the spine. So not only is it going to give you a better range of motion, but the muscles are going to get stronger, so they're going to be able to keep you in that said range of motion. So for this exercise, you're going to do 3 sets of 10 on each side, and I'm going to demonstrate that right now. So you need a nice cushy surface to sit on. Your bum is going to sit on your heels, and we're going to work the left side. So our right hand, elbow and forearm are going to sit between and just in front of our knees, and our hand is going to sit on the low back. And what we do with this exercise is we maintain that contact between the bum and the heels, which locks out the lumbar spine so it's not able to extend, so that all the extension we're going to achieve is going to come from the thoracic spine. And what we do is we try to rotate on axis through the mid-back so that we rotate up towards the ceiling and come back down. And we rotate back up towards the ceiling for 1 repetition and come back down. You notice throughout that my heels stay in contact with my butt, my elbow stays in contact with the table, I look to where I want to go, and that I'm not shifting greatly like so or like that, but all of the rotation is coming from that mid-back. So generally I want to see patients get to about 45 degrees, and sometimes we can add a little bit of overpressure in the clinic, and that should help quite a bit. Okay guys, so here we have another view, the front view of our reach back thoracic spine mobility exercise, just showing the position of the hands sitting between the knees. About 2 or 3 inches in front of the knee is where my elbow will sit, and it's also going to demonstrate how I don't shift left or right too much during the mobility exercise, but rather rotate through my spine like it's a broom connecting my neck to my bum. So here you can see my hand is on my low back, and I rotate up through that spine, keeping my butt in contact with the heels, and come back down towards the ground, and then rotate up and back towards the ground as part of my 3 sets of 10. Some people in this exercise might actually have a bit of anterior shoulder pain, which you should let me or your health practitioner know about. And a different arm position, rather than being internally rotated on the low back, is you can do external rotation on the back of the head, with the same principles applying, where we reach back and look, rotating through the spine towards the ceiling. I held that one a little bit longer than I normally would recommend. You're just holding briefly at the top, and that one takes a lot less pressure on the front of the shoulder. You'll find that if you can work on this every day or twice a day, 3 sets of 10 on both sides, that within even 1 to 2 or 3 weeks, your range of motion is much, much better. Neck pain will often go away, and you'll find that if you're doing any shoulder exercises that involve overhead press or a lot of shoulder work, your symptoms in your shoulder can often resolve as well. So if you like this exercise, check more about the shoulder and about the thoracic spine mobility work that we can do on the YouTube channel or at drritza.com.